Hey, come see with the makeup nurse. Come and take a seat with the makeup nurse. Trust me, it's a makeup nurse. Beautiful things with the makeup nurse. It's the makeup nurse. Yeah, it's the makeup nurse.
I'm back. Welcome back to my channel. The struggle is real with Jamie, the makeup nurse. Today is Wow Me Wednesday. It's also Stress Awareness Day, Nachos Day, Saxophone Day. If you want to join the Jamie Club, hit that subscribe button. Sit back, get comfy, and let's get started. This may be a long one. We are going to do in healthcare news. This is recent stuff, and I always get this from the hospital Becker's Hospital Review, and you can subscribe to that if you want, and you get daily emails with different articles coming out. So the first one is 6 infectious disease trends to know for the year. So COVID-19 this summer saw a large sum of cases than expected. However, cases have since plateaued and are going down. Experts said that because of the large summer surge, there is a possibility the winter wave will be smaller, as those infected over the summer will have immunity through January. The CDC said it's tracking a new strain, XEC, which has gained traction in the last few weeks. So hopefully we'll keep an eye on that. RSV, which is usually in children, you see that is a surge of respiratory syncytial virus, is expected to appear soon, primarily in children and adults over 65. H3N2 flu, you might have heard of the H1N1 a long time ago, but this is the H3N2 flu virus, has circulated and mutated in the southern hemispheres so that the vaccine is not as effective as in previous years. The CDC found this year's vaccine had a 34.5% effectiveness against hospitalization compared to 51.9% of last year's vaccine. The change doesn't affect vaccine recommendations, but keep a close eye on the activity. And that's for I think that flu, and we'll see the other flu. It says that the flu shot may be less effective than the past seasons, and they do look at like other, the southern hemispheres for the data. And here are the 5 things to know about that. Vaccine effectiveness was again 34.5% effective. 2023's vaccine effectiveness was 51.9%, like I just said. The drop in effectiveness could be due to fewer cases of the strain, which is the H1N1 PDM09. If the U.S. sees similar patterns, vaccine effectiveness can be expected to be similar. So, but they still recommend getting your flu shot. The Mpox. There are no new Mpox variants in the U.S. However, Mpox has made the news for its historic spread around the globe. The WHO, or the World Health Organization, declared a public health emergency of international concern, but the U.S. has the appropriate infrastructure to handle the cases. H5N1 avian flu right now is at the top of the list of viruses that public health officials are concerned about in terms of pandemic potential. There have been about 14 human infections of the H5N1 so far. Preparations have already been made to select vaccine strains that will match the H5N1 and generate a stock that can be scaled if needed. Parvovirus. In the past year, there has been a significant increase in parvovirus cases. While most recover, it's important that high-risk groups are aware of this trend. This includes pregnant individuals and people with blood disorders. High-risk groups should take extra precautions and avoid contact with children showing respiratory virus symptoms. The other thing, because of the hurricane, especially Helene, where the Baxter International made a lot of the IV fluids for our country, was affected, and so hospitals have a shortage of IV fluids. Our hospital has already put things in place to reduce fluids, like change things that they think that they can change to oral versus IV. So I'm sure many hospitals are doing that as well, because there's still a shortage, even since they weren't able to get up and going, because I think they were in or they were in North Carolina somewhere, I think by the Asheville area, obviously, because that's where it was mainly affected. So hospitals are putting proactive things in place to use the shortages or use the fluids that they have on hand and that they can get for very critical situations. There was a study, and I'm always preaching to be proactive and to be careful and put good processes in place. That's part of my job. I train people in Lean Six Sigma to hopefully so they can look at the process. But this was a study of harmful diagnostic errors, and it was done among 9,147 hospitalized patients who received general medical care. An estimated of 653 experienced a harmful diagnostic error. And this was published in BMJ Journal. The study, led by researchers at Brigham and Women's Hospital in Boston, analyzed cases of adult patients who either transferred to an ICU, died within 90 days of admission, and had complex clinical events or did not meet those criteria. Among 675 randomly sampled cases, 7.2% of the diagnostic errors were harmful, 6.1% were preventable, and 1.1% were severely harmed. Based on the sample, the researchers expect 1 in 14 patients received a harmful diagnostic error. About 62% of harmful errors were characterized by delays. So I'm always preaching and telling people, that's why it's good to have, to be proactive, ask questions. Don't just necessarily always think that they'll get back to me. Why have, question things if there needs to be a question. Always make sure because we're all human, we make mistakes, right? So be proactive in your care. Massachusetts, the reason I bring this up, if you saw my other hour-plus video on Stuart Healthcare and their bankruptcy, we have another bankruptcy in Massachusetts, and this is Gardner, Massachusetts-based Haywood Healthcare exited Chapter 11 bankruptcy after addressing contract issues, seeking commercial rate improvements and organizing finances. The health system filed paperwork to emerge from bankruptcy in May and announced its official exit September 30th. So again, another hospital, because Stuart had like 8 hospitals, in 8 or 9. I can't remember where they're at now. When I was there, I think it was 8. And so I know the state of Massachusetts is trying to get someone to purchase them so they don't close down, because they've already closed down 3 hospitals, and the state of Massachusetts needs that health care. And then a little bit about more issues with greed, I guess. Ex-tenant execs face $400 million kickback trial. So a $400 million fraud and kickback case against former tenant healthcare executives may finally advance to trial after federal investigators received the green light to use statements from 10 alleged co-conspirators. So 5 things to know. John Holland previously served as a vice president of operations for Tenet's Southern States region and as CEO of North Fulton Medical Center in Roswell, Georgia. In October 16, Tenet paid $514 million to resolve allegations it paid kickbacks for patient referrals. However, in February 17, the Justice Department alleged Mr. Holland also evaded Tenet's accounting controls to pay illegal kickbacks to clinics in Georgia and South Carolina, which referred pregnant patients on Medicaid to Tenet hospitals. Prosecutors allege Tenet billed Medicaid more than $400 million as a result of these referrals. Other defendants in the case include William Moore, former vice president of operations for Tenet and CEO of Atlanta Medical Center. I used to work there, but they said this was when it was under Tenet's control. When I worked there, it was under Wellstar. And Edmunda Coda, CEO of a company that operated clinics for predominantly undocumented women. Prosecutors allege Tenet paid $12 million in kickbacks to one of Mr. Coda's clinics, Clinica de la Mama in Norcross, Georgia, to ensure patients gave birth at Tenet hospitals between 2000 and 2013. Mr. Holland has waited almost 8 years to go to trial after being told more than 10 years ago that he was the target of a government investigation involving allegations of misconduct. And the trial against Mr. Holland, Mr. Moore, and Mr. Cota had been stalled as prosecutors appealed a judge's ruling that blocked out of court statements from the alleged co-conspirators, according to the Atlanta Journal-Constitution. So obviously everybody is innocent until proven guilty, so maybe we'll hear more to come. Another closure in Mayo Clinic Health System in Fairmont, Minnesota will permanently close its surgical and labor and delivery units effective March 31st. So this may affect some of you who live in that area. Surgeries, procedures, inpatient OB, and inpatient pediatric admissions will end on March 31st. So expecting mothers will continue to be diverted to Mankato, Minnesota, or another location until the official service closure, according to the health system. So, and they're saying because with physician shortages, ongoing recruitment challenges, and low surgical and birth volumes, we are unable to continue the experience. So they had to close it. And Mayo Clinic, I know, is a great hospital, so that's sad that they're closing those services. And I found this interesting, especially with some of the closures and the sudden closures. This might actually be a good thing that California is doing. Governor Gavin Newsom signed the Senate Bill 1300 into law on September 28th, which requires hospitals to notify the state when planning to close labor and delivery or psychiatric units. This was according to a September 29th Cal Matters report. This law requires a 120-day notice of impending unit closure, a 30-day increase from the current 90-day requirement. So this allows an extra month to try to look for services, because these areas are, these service lines are closing more and more throughout the country that I'm seeing, and it's because it's not great reimbursement. It's hard to keep your doors open financially, but these are services that are really needed to our population, especially psychiatric services. So I know some states are or some of the Federal Trade Commission is trying to prevent closures of some of the psychiatric hospitals and stuff like that when people want to close, because it's very well needed. So I'm kind of like that bill and that law, because I know some hospitals I've seen also close within 30 days. It's wait, what? And no one really knew. And so that will kind of help. And this law also requires the hospitals to hold a public hearing to provide justification for the planned unit closure. The bad thing is, yes, I get if you're not making money on those areas and you need to close down, and the state's no, you can't. Well, then what is the state going to do for that hospital, right? Are they going to fund it then to stay open? They need to come up with plans if the hospital's not making money, right? And the last news I have, this is a Pennsylvania hospital secures license after delays. So if a hospital gets in trouble from a survey, they can take away funding from you. You have your doors open, but you don't get the license. You don't get the Medicaid, Medicaid funding. You pretty much have to operate without any funding until you correct the issues that they cite you for. So this hospital in Pennsylvania, St. Christopher's Hospital for Children in Philadelphia, has been granted a 3-year license after the previous failed attempt. So it finally has its license. This was from the Philadelphia Inquirer, reported on October 11th. The hospital had operated with 2 6-month temporary licenses since July of 23. It secured the 3-year license this July after a May visit from the Pennsylvania Department of Health determined the hospital resolved issues flagged in previous inspections. So it finally resolved it. St. Christopher's was cited for violations related to safety, sanitation, and patient privacy in May of 2023. The issues from the May visit had been corrected by the time inspectors returned in November, but the hospital was then cited for different safety and sanitation violations. So they corrected what they needed to, but then they found other things. Then they obviously had to correct those in order to open or like get their license again. And so they did effectively July 21st, 2024, receive its full 3-year relicensure, which is great. Especially because these hospitals, yes, we need to stay safe, but we also have to have the services. So I'm glad that, they come in and they keep the doors open and work through the issues, but take away the funding, because that's obviously their consequence for not following the regulations and having the violations. So over the past 5 years, only 5 Pennsylvania hospitals have received temporary licenses, and 3 of them required another temporary license. The local outlet reported in February. So it sounds like these hospitals in Pennsylvania need a little bit better quality control. That's kind of what my job is, right? And I always try my best to make sure I have these processes in place that really are good for our patients, will help our patients' safety and also our employees' workload. I always look at that as well, and that's part of my job. So it makes me sad whenever I hear things like that, because we need hospitals to stay open, but we also need to provide good patient care as well and safe care. All right, that is it for this week's In Healthcare News. Let me know what you think down below. And the riddle of the day is, what's Bigfoot's favorite part to sing? Comment down below, and remember, don't wake up and choose violence, choose kindness, and I'll see you next time. Bye!